Moral distress is the feeling that you know in your heart, you believe you know the ethically correct thing to do, but something or someone keeps you from doing it. And that thing could be something internal to you, it could be something external to you. But basically you feel like your integrity, who you are as a clinician, is compromised. And you're feeling like you can't do what you know is the right thing to do. It's not just, oh, I feel bad, it's a really sad situation. It's much deeper than that.
When you see a problem, that you feel that you have no agency, you can't do anything about it. You see a moral issue that troubles you greatly, that's in opposition to your own values or beliefs, but you see this problem, you see this moral dilemma, and you feel that your hands are tied, that you can't do anything about it.
Moral distress was first identified in amongst nurses, and it's gotten a reputation for being a nursing issue, but it's not a nursing issue at all. It's all healthcare providers. We now know, we have evidence, strong evidence, that moral distress exists in nurses, physicians, respiratory therapists, social workers, chaplains, nutritionists, you name it, it's there. When I teach about moral distress to staff as an in-service or as a lecture somewhere, you can see the light go on in people's eyes, like, oh, there's a concept, there's a word for that. That's what I've been feeling this whole time. And you can't be a healthcare provider in any level and be morally immune to what you're doing. It's morally difficult taking care of sick patients and their families. And once you become numb to it, that's a problem.
To define moral distress, I think about it in a clinical context. When a clinician is asked or demanded to provide the kind of treatment that they feel that they should not provide as a professional. So it arises most often when a clinician is not the major decision maker in a case. Therefore, it happens a lot with medical students. It happens to nurses. It's not infrequently brought up by social workers when they are tossed into a situation where others are making decisions and they must participate clinically in providing treatment or care of some sort that they feel is wrong. And it usually is wrong either from some fabric within them or what they see their role as being a professional.
I've been a nurse for 38 years, and in those years, especially early on, before we even had true ethics committees, what I witnessed amongst my colleagues, nurses, physicians, social workers, and myself was in the midst of these ethical conflicts that evolved into often true conflicts because they were the toughest of the cases, that people walked away harmed, essentially. In 1984, we had Jamison define moral distress for us. And it was an aha moment for most nurses of saying, this is what I'm experiencing. This idea of being constrained, of believing that you know the morally right thing to do, but literally being constrained from carrying out that action. And those constraints can be anything from a legal binding situation, it can be policy, it can be resources. There are many reasons why we are constrained. Time can constrain us. And so the effect of that, and of course most of us are in the profession a long time, and so it's not just one incident of moral distress, of going home at night and putting your head on the pillow and thinking about what I failed to do, what I was not able to do in the moment, that I believed I was morally obligated to do. Living with that, not just that one time, but over and over and over again, how that impacted myself and my colleagues, living with that and watching it escalate over time. The people who care the most about ethical issues are in harm's way. They, in their core, have a sense of ethics that drives them in their profession and their obligations to their peers, their obligations to the families, to the patients. And so to hit someone in the place of their core values. Why am I a nurse? Why have I come over and over to that bedside? Because I believe in serving the other, caring for the other. And so if I believe that I'm harming the other, how do I live with that? So for me, it has been a passion to really begin to think about how do we, I mean, we've clearly defined it now. But the question becomes, now what do we do with it? Because given the fact that you have ethical conflict, you will always have moral distress. People will come to the table with different values. So now the question is, what do we do about it? And we're just beginning to really think about the interventions now.